Medical tourism is the phenomenon of people traveling abroad with the intent of accessing medical care, one of the most popularized being cosmetic procedures. The Middle East, South America, Africa, and the Caribbean are among the most popular cosmetic tourism destinations. It is one of the fastest growing sectors of the healthcare industry, grossing approximately $60 billion in the previous year. Cosmetic tourism is largely cost savings driven. For example, a rhinoplasty that will usually cost around $8,000 in North America will cost around $4,500 in Costa Rica, a gross savings of approximately 45%. Other advantages may include shorter waiting lists, accessibility to more difficult procedures, as well as the preservation of patient anonymity. Despite these advantages, many issues may arise when complications occur due to the lack of quality in follow-up care. Regularly reported complications, especially for rhinoplasties done abroad, are infections, wound adhesions, pain and discomfort, and anesthetic dissatisfaction. In rhinoplasties, whether a skin incision is made or not, there is always an intranasal incision, which leads to the contamination of the skin's soft tissue envelope. The deficiency in standards of care abroad usually lead to perioperative infections, which are essentially infections occurring from the time when the patient goes into the hospital for surgery until the time the patient is discharged home. Non-tuberculous, rapidly growing mycobacteria, or NTRGM, are an emerging pathogen group becoming increasingly more common in patients seeking rhinoplasties abroad. NTRGM regarding rhinoplasties usually creates skin and soft tissue infections, or open up traumatic injuries. Inexpensive and low chemical methods of sterilization have been implicated in the outbreak of mycobacterial infections. Also, there has been a linkage to portable water supplies in some countries with the outbreak as well. Patients infected with NTRGM predominantly exhibited erythema, which is essentially the redness of the infected skin, tenderness, and serious drainage from surgical wounds. Many of these individuals required surgical interventions and antibiotic therapy where the infection was able to be treated. Now that we have discussed the complications that can occur, how can patients and healthcare professionals mitigate these risks abroad? It is essential to seek consultation with the performing surgeon prior to the operation. Here, tourists should be made aware of the differences in medical care, infection rates, and risks between hospitals in developing and developed countries, as well as the risk of bacterial colonization, which may lead to hospital-acquired infections during travel. It is also essential that medical staff record a standardized minimum data set at the time of the surgery. This is an accurate description of the medical care resources used and diagnosis during the patient's surgery. All of these can be used to compare across different populations and geographical areas. This form can then be used by patients, and if complications arise, the treating physician will have access to operative details. Also, this can be used to improve resource allocation, time to diagnose, and the overall morbidity and mortality of the patient. Destinations for cosmetic tourism should maintain a clinical quality register. This would allow for transparent assessment of quality care in relation to international standards. This approach specifically is endorsed by the International Confederation of Plastic Surgery Societies. Last, websites need to be more informative and accessible, including information related to risks, follow-up care, and the aspects of travel prior to engaging in surgery abroad.